Hi, welcome to this very exciting podcast. My name is Dr. Sheri Gibson.
And I'm Dr. Regina Lewis.
And we are here on behalf of the Connecticut Long-Term Care State Ombudsman with a generous funding through the CARES Act. And we are just very excited and pleased to bring to you a series of podcasts, what we hope will be a very engaging conversation between the two of us about topics that are on the hearts and minds of a lot of residents and families in long-term care. With the aim of fostering cultural inclusion in long-term care for residents and for families. And so I think I'd like to start out by talking about cultural inclusion and this idea of raising our cultural responsiveness.
Absolutely.
Maybe you could start us off.
Absolutely. So, we talk about cultural inclusion, and really it's about being responsive to the different cultures that people have. This is our values, beliefs, ideologies. I mean, there's just a plethora of things that people have in their life. But oftentimes we don't address that. We kind of approach everyone like just the same, and we can't do that. We have to be able to respond to their needs and meeting them where they are, where they work, where they live, where they play, where they worship, and be able to have those conversations. And so what does that really look like? So we'll look at the intersection of people, that it's more than just male or female or race. There's so many different layers. And how do we really address them and being sensitive to their needs?
That's such an important topic, especially in this past year, where certainly we've all had to adjust to the mass tragedy of the pandemic. But then also in the middle of all of that, we had the very tragic killing of George Floyd that then kind of raised up a new level of awareness for people and triggered a lot of past trauma for so many communities and Black and Brown communities who really couldn't sit in the wake of that tragedy and who had very righteous anger around that. And so much has happened in the context and under the blanket of a global pandemic.
Yes, but I also think that this is wonderful times. Unfortunately, through these tragic times, it has brought up an awareness that Black and Brown people have been dealing with for centuries. And so they already knew it, but I think they couldn't get the message across to say, this is what I need. This is what makes me unique. And this is the challenges that I have concerning what it is that I'm doing, especially in healthcare. Yes, you're going to take care of me. However, I have unique needs. And so what this has actually done is brought an awareness to a point where there's more empathy, more understanding, and people want to know, how can I really help?
Right.
What can I do to meet your unique needs?
Right.
So here we are.
Here we are.
That's it.
Well, this is going to be a wonderful series, and I'm just so excited for both of us to bring our own expertise to this table.
Sure.
My expertise in aging and the psychology of aging, and your expertise.
My expertise is in intercultural communication, in psychology, as well as in leadership. So just really looking at all of these areas and bringing them together is going to be fantastic. And then also, I'm my mother's caregiver, and so I have my own firsthand experiences of challenges and concerns.
Yes.
So I think that this is a really timely
topic.
Yeah.
So I want to maybe introduce this first topic of concern, which I think in my work with long-term care and working with residents and also ombudsmen across our country is this fear and anxiety that we're all experiencing against a ever-changing landscape of the pandemic. Chasing the virus, also feeling that we're being chased by an invisible assailant. We don't know when it's going to attack. We don't know who of us are the most vulnerable. We hear lots of different messages from our government from the very beginning of the pandemic until now, and so much is impacted in that. We've never seen in this country the type of mass death that we have seen with this pandemic. I think we are approaching now almost 500,000 in the U.S. Who have lost their lives to coronavirus. But we've also seen just the inability of healthcare systems to respond to this widespread illness. And fractured caregiver attachments. I mean, so many stories across our country. You also are a caregiver of your mother,
Sure.
but families really wrestling with the idea that their loved one is in a long-term care facility. They can't visit them as they once did. And the visits that they've had have been between glass or in a courtyard when the weather was, permitted that to happen. But then also families who have lost their loved ones dying alone within long-term care.
Oh, absolutely.
Long-term care settings who have lost their own healthcare workers to the virus, or administrators who have died. And so all of this, I think, has created this brewing of fear and anxiety. And anxiety from a psychological perspective is really the unknown.
Right.
It's everything in the future. What is going to happen tomorrow? What isn't going to happen? Where do I go to next?
Right.
And that's where we find ourselves in the grip of this pandemic.
Absolutely. I also see not only dying alone sometimes, or having that social distancing when we're used to touching or being much closer, but there's also rituals. If you think about cultural rituals, how we take care of our family, how do we, if a person passes away, how do we celebrate that?
True.
And it's very different. And we have been to a point where we've had to do it online, virtually.
Right.
Or postpone it. I know that my uncle passed away, and we have to celebrate it probably a year or two later. Very, very different.
Right. This idea, this new concept that we're hearing about of e-mourning.
Oh, yes.
And that's what we've had to do, especially in long-term care, where this is a very high-touch kind of environment, and we've had to become high-tech in our care, which is so discrepant from the way we've always provided care.
Sure. So when we start thinking about, being culturally responsive, even before culturally responsive, let's talk about some of the challenges and the fears that individuals actually go through in terms of those layers of culture.
Yeah.
So, when we start thinking about getting the vaccine, oh my goodness, what do we do? Or even the care. We have to start looking at the long-standing historically systemic challenges that have taken place in our nation that has gone against the grain of different cultures.
Right.
If you look at the history and see what happened when we were getting the vaccine with syphilis and the many lives that were lost at that time, the unfair treatment and preventing people from getting, fair treatment.
And the lies that were told.
Right.
That it wasn't transparent to
right.
people about what was going on.
Absolutely.
And those kinds of historical marks are deep wounds that stay with people even now.
So I want to ask you something, Dr. Gibson. Do you see that the physicians that show up are not really, in terms of ethnicity, they're not reflective of the population that they serve? Do you see that?
I think that it depends across the country where we are.
Sure.
So, for example, in this city where we're coming to you from, Colorado Springs, which is a mid-sized city,
right,
predominantly white.
Right.
And so in that case, I think in this city, we have a predominantly white physician healthcare practice, which reflects our demographic here.
Absolutely.
And unfortunately is is not helpful for the minority demographic in this city.
That's right.
Now, I would imagine in urban Chicago, it would be a very different demographic of both healthcare providers and the demographic of that patient population. So I think it really depends on where you are and who would be serving you based on where you're living.
Absolutely. But just imagine, and I've gone through it myself. You go into a physician's office, you're very concerned, you have many different challenges, and you're trying to express that to the doctor who doesn't look like you.
Right.
And so, not that they can't relate to who you are or your experiences. I'm not saying that, but what I am saying is at first glance, you start to feel uneasy. You're not really sure, can this person relate to me? Do they have these concerns? Like a very simple example is, I remember when my sister was going to have some surgery, and we just so happened to have a doctor who was African American. And the first thing that he said was, I want to be careful of how we do the incision, because I know that many African Americans, because of the pigment of their skin, actually start to have scarring.
I see.
Right? And so he was aware of that.
Right.
And so that put us at ease.
Sure. It's such a nuance.
Absolutely.
Such a nuanced piece. Put you at ease.
Absolutely.
As a family and as a patient.
Right, exactly. And so then it becomes very concerning. So what do we do about all of this? I'm starting to think of, what can the individual do? What can we do as a community?
Right.
What does that actually look like? Well, I know that one, we need to make sure that we maintain support and connections. We need to make sure that we're meeting people where they are. So maybe it is that we have to bring vaccines to them.
Yeah.
How about access to the information? Who's getting it? What has been the impact for people who look like them? My daughter-in-law called me, and she was concerned. She says, I want to have children one day. Do you know anybody who has had the vaccine who has had children or is planning on having children?
Right.
So it's the same thing for long-term care. I want to know, what is it going to be like for my mother, who's African American and in her late 80s?
Yep.
So those layers are going to be really important to make sure, something that the individual can do is tap into their past experiences. So this year celebrates the 30th year since Desert Storm. So I'm a war veteran. And during that time, we had a chemical war. We couldn't taste it, see it, smell it, touch it.
Yep.
Just like this.
Right.
And so for many of us, what I've been telling war veterans of that era is, tap into what sustained you then, because you're here today. Tap into that.
Yes.
We have to realize, especially for our seniors, that they have seen so much.
Right.
And I believe that they can reach back to say, this isn't new.
You're absolutely right. And that translates so perfectly to working with older adults. In my own practice as a psychologist, that is one of the type of healing that can happen in using a strength-based approach.
Yes.
So what are the person's strengths, and how do we see that in the person? How do we draw it out by virtue of years of accumulated wisdom and experience?
Absolutely.
And so oftentimes maybe we can ask our loved ones who are residents in long-term care, what got you through some of the hardest times of your life?
That's wonderful.
And how does that translate to now?
Right.
Whether it was your faith or it was connecting with your family, and how do we use those strengths and become creative about how we do that now?
I think you were spot on when you said be creative, because we have to find new and innovative ways that aren't going to go away.
Right.
So when people think, you know what, I'll be glad when this is over.
Yeah.
Our entire culture has shifted, and so we have to be very, malleable to move with it.
Yes, exactly. We have to adapt.
That's exactly right.
Right.
And so when we do, we can think of other ways, and we can create rituals that still fit within our own culture, our
True.
own beliefs.
Yes, absolutely. Absolutely. I'm wondering what kinds of, other than drawing out the strengths of people, and I would suspect from a cultural sensitive place that we can ask questions that also you made a comment to me a while back when you and I were kind of prepping and having our
Sure.
conversations
Sure.
and talking about how we can draw out the courage, especially of minority people, that there's so much courage and strength in just being of that subset of our very important diverse population in the US. And so how do we see it through a lens, even through not just the individual experience, but as a cultural experience?
Absolutely.
That person comes to us with an enormous amount of strength and courage.
It's deeply rooted. It's part of our DNA. It's part of our ancestry. And so if we look to that, instead of saying, "Oh, woe am I," right? I mean, yeah, there's horrible stories that we could tell.
Right.
Where can we pull the strengths, and how was that? How did that come to be?
Yeah.
I do know that in the African American culture, we're a very spiritual people. So Dr. A. Wade Boykin talks about and wrote about the 9 dimensions of African American culture. And some of those dimensions is communalism. So we're communal. We gather together. That's something that's really important. Go back to the family. Go back to your roots. Start to find out what the history is. Share the stories. Our seniors can share amazing stories that we can use and pass on for our strengths, which I think is really important.
Right.
Another that's really important is spirituality. We need to take a lot of this information, take it into the churches, take it into all of the spiritual places and spaces.
Right.
And let it start to come through that, because it speaks a different language. It meets people where they are, because that's where we're going to turn to, because it's the faith that has brought us historically to where we are today.
Absolutely.
So I think that that's important.
That's really important.
And it's not just about the African American. It is all cultures.
Yes.
And really looking at, what did your ancestors go through? Deep.
Yeah. Very nice reminder for all of us to consider the bigger picture, the historical picture.
Absolutely.
So when we think about fear and anxiety, that's the oppression that a lot of people are feeling on them right now.
Right.
But we're encouraging all of you out there to also see the potential and the opportunity for strength, and to tap into those things with your loved ones in long-term care. I think it's also important to bring us back to like some real tangible skills that people can use. I don't know about you, Regina, but I've been in situations where all of a sudden the anxiety is so palpable. It wakes me up in the middle of the night. It sticks with me, and I can feel, my heart racing or my palms sweating, and so I wonder. It seems like people would benefit maybe from some real skill about how do we bring ourselves down. And by down, I mean like stable.
Yes, right.
And, I have a friend who says, woosah.
Oh,
that's the
absolutely.
woosah. How do we find that moment when we are feeling so anxious?
Right.
So one of the things I would like to share with our viewers is a really simple acronym that was developed by a well-renowned psychologist in the field. His name is Dr. Russell Harris, and he teaches a type of modality therapy, a therapeutic modality called acceptance and commitment therapy. And I won't go into all the nuances of that, but I have found that this acronym that he provided to all of us in the helping professions has been really helpful in my practice.
Oh, okay.
So maybe we could try it.
Yes.
So the acronym is called Face COVID, but for the sake of our time today, I'm just going to take us through the face part.
Okay, sure.
So I'll just tell you what FACE stands for. The F stands for focusing on what's in our control.
Right.
Because oftentimes we don't feel like we have control, especially I think with this pandemic, especially for families who are wondering all the time, when can I go back in to see my loved one? And residents of long-term care always wondering, when am I going to be able to get out, even if it's out of my room, to eat in the dining room? I mean, it's those small things that people feel that they don't have any control over, and they're constantly wondering.
I think that's important. Into, a way to remember that is you can only control your controllables.
That's right.
You can only control your controllables.
Your controllables. That's a wonderful way to remind ourselves of that. And so focusing on what's in our control. If you'll think about the metaphor or the image of a ship in a harbor, a boat in a harbor, and there's a big storm brewing.
Sure.
And so what do boats do? They throw out their anchor.
Right.
Right? And anchors don't control the weather, but anchor keeps the boat from going out into the sea and being lost until the weather passes.
Right.
And that's just like anxiety. It will pass. It can't stay with us forever. So the rest of the acronym, the ACE, I want people to think about, this is your anchor. Okay, so this is your anchor. When you're feeling the storm brewing, you need to pitch the anchor and wait it out.
Right, right.
So the A stands for acknowledge, acknowledging your thoughts and your feelings. Because so much of this, we can't control our thoughts and feelings. They just come in without any notice, right? And all of a sudden you find yourself feeling anxious. So we have to acknowledge it. And we're kind of a culture here in the United States where we typically push things under the rug.
Right.
We distract, we do other things, shopping or whatever it is to avoid those difficult emotions. And what Dr. Harris teaches here is that we want to acknowledge it. So the way we do that is simply to say, I'm feeling anxious.
Right.
There's grief again. I am having the thought that I'm fearful of being sick. I'm having the thought that I'm not going to be able to see my loved one again or hold my grandchildren again. And by acknowledging the thoughts and feelings, we are essentially giving them that, kind of honoring them, but not avoiding. Because what happens when we avoid those things, you can think about a floaty that you used to put on your kids' arms.
Yes.
If you push one of those under the water, the deeper and deeper you push it, when you raise your hands from it, it pops up.
Right.
And it will pop up really hard, really fast, and usually at times where we don't know that it's coming. Like we don't see it coming.
Right.
Right? And so all of a sudden you're angry or you're crying for no reason. I know I've been there a couple of times.
Sure. So we all have. I think that so many of us have experienced emotions that we probably really either suppressed or we just haven't had to even have it come up.
Right.
So Reverend Norm Burchard, he is the Reverend for the Center for Spiritual Living here in Colorado Springs.
Right.
Amazing man. And he says that when you acknowledge that, he said, just say, I know why you're here, because a lot of times that comes up as a fight or flight or to protect you. I know why you're here. I'll call you when I need you.
Isn't
and let it
that neat?
go.
That's very helpful. I can see where that would be really have a lot of utility for people.
Absolutely.
Acknowledging it and letting them know, hey, I'll call on you when I'm ready.
Right. I don't need you now.
That's great.
Yeah.
Good. So the C in the ACE, the C is coming back into your body. Sometimes feelings and emotions and thoughts, they need a place to go.
Right.
And one of the best ways for us to do that is to get back in touch with our bodies.
Yes.
And we can do that in such simple ways. One is, being mindful of our breath.
Yes.
The simple breath that we take.
Yes.
You know, just noticing how it feels to take a deep breath in.
Mm-hmm.
Another way that people can do this is just even straightening our backs.
Oh, yes.
And just feeling like, okay, I'm here, I'm grounded.
Mm-hmm.
Noticing when your feet are on the floor. Maybe it's about taking a walk or doing some stretches.
Right.
But coming back into the body is a really important aspect.
Absolutely.
When people are anxious, we tend to disassociate
Right.
from our bodies.
Right.
Right? We're so in our head, we're brewing all this stuff, and we forget that our body is here. And if you notice, when you're anxious, you might, if you pay attention to your body, your shoulders might be scrunched. I've actually been sitting with my hands clenched at times.
And then you look down and go,
oh my gosh.
You know, and when you talk about hands, we have so many nerve endings on the tips of our fingers.
Right.
And so I was told to just take and squeeze them together. And it permeates through your entire body, or tapping right here. Just tapping. And this just kind of brings you back like, okay, I'm okay.
I'm okay. That's a really good. Yeah, there's so many wonderful tools for us to use.
Oh, yes,
aren't there?
Absolutely.
And then the last one is engaging fully in what you're doing. So once you have focused on what's in your control, you acknowledge those thoughts and feelings, you come back into your body. Now you want to throw yourself into whatever activity you're doing.
Right.
Whether that is washing your dishes, folding the laundry, preparing for a meeting, whatever that may be, you want to really dive into it fully.
Exactly. You know that you're here. Take a moment to breathe it. Look around into your surroundings and say, I am here.
Right.
And find that appreciation for being here.
Yes, exactly.
So I agree with that. I know that sometimes, when you just stand and you put your feet shoulder width apart, it's hard to have somebody tilt you over, because you are grounding yourselves. And sometimes it's just about, and I call it bracing, just place your feet there, because now you know that you are strong. So these things are all important. I love this. This is fantastic.
Yes. Well, I think the two of us have a lot of tools, right?
Yes. Yes.
and some of you out there have your own set of tools.
Sure.
And so this is just maybe adding something to that toolbox, or, I kind of refer to any interventions that ever I throw out as like spaghetti.
Right.
You throw it at the wall and see what sticks.
Right.
So some of these will stick and some won't, and that's okay. I think the idea here is, how do we get through this time?
Right.
So I think we're about to the end of this podcast.
Yes.
Do we have any final thoughts as we wrap this up?
One thought that I have is, and especially in a cultural realm, many cultures really surround themselves around two things, and that's food and music. And so use that. Reach into the music. Hum. If you look at our history, this is what we've done to get to where we are. We come together with food. Create something different, healthy, but different. So I think that those are two things. And I just want to say that I really appreciate all of you tuning in with us today to have this conversation, because it's so important. But we want to make sure that you are engaged as well, and that you feel like there's a sense of belonging in this conversation.
Thank you. Thank you so much. That is so well put, Regina.
Thank you.
I too am very happy to be here with all of you, and we just are excited to continue the dialogue, continue this conversation, and we want all of you to take what we've talked here about today, take that into your dining rooms, take that into your families, and if you're a resident watching this podcast, or a caregiver or a family member, continue talking about these topics.
Absolutely.
Outside of this moment. So thank you again. We really appreciate it. We'll see you next time.